7 medications that could damage your brain. For a long time, doctors had maintained that dementia and the process of forgetfulness, confusion, and mental fog were part of the normal aging process. However, it is known that memory loss in old age can be prevented today. Memory and specific routine skills and knowledge can even improve as the years go by. It is known that alcohol abuse, smoking, brain injuries, strokes, insomnia, chronic and permanent stress, as well as deficiency of some substances such as vitamin B12 and some psychiatric disorders are involved with early memory loss. What very few people know is that memory loss can also be associated with the prolonged continuous use of some common medications that are consumed for different reasons and seem harmless but ultimately have adverse effects. Did you know that there are medications that can cause long-term cognitive alterations, or that a large percentage of cases of memory loss in young adults may be due to the indiscriminate use of some medicines? Learn which medications can cause effects. You'll be surprised to learn about this list in detail. Keep watching this video and learn much more about this exciting topic. Medicine 1. Taking omeprazole and other proton pump inhibitors for stomach acidity. Omeprazole is part of a group of molecules called proton pump inhibitors, among which we currently find other varieties such as lansoprazole, dexlansoprazole, pantoprazole, esomeprazole, and rabeprazole. These medications are designed to decrease gastric acid secretion, improve stomach pH, and therefore improve acidity and gastritis symptoms and help heal gastric, duodenal, and esophageal ulcers. Most of these medications are over-the-counter in pharmacies and do not require a prescription, so millions worldwide consume omeprazole or any of its varieties for a long time without a medical prescription. Gastrointestinal pathologies associated with increased gastric acid are widespread, and today it is considered that 50% of the population in Western countries recurrently suffers from acidity or acid reflux. This type of medication is highly effective for symptoms of acidity, heartburn, and reflux. It has few adverse effects, so most people consume it without precaution, and consulting a doctor, it has not been established what is the maximum time this type of medication can be taken safely without presenting long-term side effects. However, sufficient scientific evidence supports the idea that its use should be avoided for prolonged periods if no proven medical pathology justifies it. One of the long-term side effects that has been observed in proton pump inhibitors is the association with cognitive disorders and dementia, and some extensive population studies have been able to establish a connection between sustained intake of this medication and memory loss. A study that included almost 6,000 people for approximately 5 years established that 10% of patients who took omeprazole for more than 3 years continuously presented memory loss. In this study, other risk factors for cognitive disorders were taken into account, and it could be determined that the intake of proton pump inhibitors or omeprazole is considered an independent factor that increases the risk of dementia. In that same study, 33% of patients who took omeprazole with an average of 4.5 years continuously reported having cognitive disorders with memory loss. Similar studies have reported similar results. Although it has not yet been possible to determine precisely the pathophysiological connection through which these medications can generate memory loss, more research is needed to demonstrate this link. For now, it is known that proton pump inhibitors decrease the absorption of vitamin B12, and chronic deficiency of this vitamin in the blood can cause neurological disorders and cognitive problems. Another of the proposed mechanisms is changes at the level of the intestinal microbiota that omeprazole can cause, and that may be related to other mental disorders. Factors to consider if you will take omeprazole or other proton pump inhibitors. The exact determination of the time in which omeprazole can be consumed, and the fact that your doctor should always consult its doses. In all cases, in the presence of digestive symptoms, the exact nature and origin of the same should be determined to avoid excessive and unjustified consumption of omeprazole. It is also important to consider consuming other medical options or diet alternatives to reduce symptoms. The gastroenterologist indicates omeprazole after demonstrating the presence of gastritis, erosions, or ulcers in the duodenum, stomach, or esophagus that fully justify the consumption of these medications. However, in most cases of gastric or esophageal erosions or ulcers, the average consumption is from 2 weeks to 3 months, during which time adjustments in diet and eating habits should be made that allow the medication to be suspended without digestive symptoms reappearing. When there are gastric lesions, a new endoscopic review is recommended after treatment in which the healing of erosions or ulcers is verified to suspend omeprazole and continue with other therapeutic measures safely. Only in exceptional cases can the gastroenterologist leave the proton pump inhibitor or omeprazole continuously or for much longer, and the patient should receive a warning about the long-term side effects. In addition to memory loss, kidney problems, deficiencies of some vitamins, strokes, stomach cancer, osteoporosis fractures, and a greater predisposition to respiratory and intestinal infections, among other effects, have also been linked. Medicine 2. Anticholinergics. Anticholinergics are drugs that block the action of acetylcholine, an essential neurotransmitter released by neurons that allows signals to be transmitted between one neuron and another acetylcholine, therefore contributes to the mechanism of concentration and memory. It also contributes to sleep, blood vessels, the urinary, digestive, and airways. Drugs that block the action of this neurotransmitter can alter the functioning of many organs. However, anticholinergics are used very frequently to control tremors, such as in the case of Parkinson's, control nausea, decrease symptoms of overactive bladder, and decrease respiratory symptoms in some cases of chronic bronchospasm. One of the main therapeutic effects that these medications cause is a decrease in movement. Therefore, they reduce tremors in patients with involuntary movement disorders such as Parkinson's disease. However, due to their long-term side effects, anticholinergics are prescribed for a limited time and at low doses in people under 70 years of age. As they cause quite a few cognitive alterations currently, anticholinergics can be used in combination with other drugs to decrease the dose and thus reduce side effects. It has been fully demonstrated that the continuous use of anticholinergics causes memory problems. It is considered that more than 3 years of constant consumption of anticholinergics can be associated with a 54% increase in the risk of dementia. However, anticholinergics are also used to treat other health problems. One of them is known to improve bronchospasm in asthmatic patients, and it is very common ipratropium bromide, an anticholinergic widely used as an inhaled administration medication. Side effects at the memory level are scarce and have not been reported. A recent review in which 138 studies were studied about the adverse effects of anticholinergics found that some of them, especially those administered orally, have been associated with cognitive disorders. In contrast, anticholinergics used in asthmatics via inhalation have not. A study developed by the University of Washington examined more than 3,500 men and women over 65 years of age who took anticholinergic medications, both prescribed and over-the-counter, for an average of 10 years, and it was determined that more than 800 of them developed dementia before the 10 years that the study lasted. The researchers examined other risk factors and saw no differences with the rest of the medication of patients who did not have cognitive disorders. It was also determined that the risk of dementia was higher as more doses of anticholinergic drugs were taken, and that this effect was cumulative. Examples of anticholinergics. Cognitive effects have been observed with scopolamine, mecamylamine, atropine, piperidine, oxybutynin, diphenhydramine, and dicyclamine. On the other hand, glycopyrrolate, trospium, tolterodine, darafenacin, fesoterodine, tiotropium, and ipratropium were not associated with cognitive decline. Medicine 3. The use of corticosteroids. Corticosteroids for asthma and allergy are associated with brain deterioration. Asthma and bronchospasms are treated mainly with glucocorticoids, anti-inflammatory medications that can be used orally and intravenously, and inhalation corticoids are also used as anti-inflammatories for joint disorders, allergies, chronic obstructive pulmonary diseases, Crohn's disease, inflammatory bowel disease, some types of dermatitis, and autoimmune diseases such as lupus and rheumatoid arthritis. In the case of bronchial asthma, apart from corticosteroids, combinations of bronchodilators are used to relieve symptoms according to the intensity and frequency of the crisis, the patient's age, and their personal history. However, in the case of oral glucocorticoids, a connection has been established between their regular consumption and structural abnormalities of the brain, as well as mental health disorders such as disorientation, confusion, depression, and anxiety. Scientific studies have shown that people who have lived with asthma have higher rates of cognitive decline and memory disorders. A large epidemiological study conducted in the United Kingdom, which investigated the background of more than 500,000 people between 2000 and 2010, found that those people who took glucocorticoids for asthma for a long time had a higher risk of suffering from dementia, as well as other types of mental health problems. Alterations in mood and sleep patterns were also observed. It was determined that people who take chronic steroids for Cushing's disease, as well as people with depression and bipolar disorder who have associated cognitive impairment, show a dysfunction of the brain area called the hippocampus, which is closely related to neurogenesis and neuronal remodeling. These alterations, visible by magnetic resonance imaging, could be the origin of memory disorders, emotional processing, and vulnerability to stress. This increase in the risk of cognitive disorders is observed when oral corticosteroids are ingested for a long time. Fortunately, the use of inhaled corticoids, which are currently used more frequently in most asthmatic patients, has not been related to cognitive disorders. Examples of corticosteroids for asthma and allergy. The best-known oral glucocorticoids are prednisone and dexamethasone. Among the most used inhaled glucocorticoids are fluticasone, budesonide, mometasone, beclomethasone, and cyclophosphamide. Medicine 4. Anxiety medications. Among the drugs used to control anxiety symptoms and insomnia are benzodiazepines. These are medications that have a very rapid effect and are used by a large number of people worldwide. However, benzodiazepines, despite having a pretty good safety profile, can also cause neurological adverse effects in the medium and long term. An increase in the incidence of suicides, behavioral changes, or even the appearance of new nonspecific neurological symptoms has been described after the long-term use of this type of medication. Some studies have reported that more than 40% of people who use this type of anxiolytics have experienced even more than 17 different neurological symptoms that can last for weeks or months. Among the symptoms most reported after prolonged intake of benzodiazepines are difficulty concentrating, lack of energy, anxiety, nervousness, sleep problems, increased sensitivity to light and sound, digestive disorders, myalgia, and muscle weakness. However, one of the symptoms that occurs more frequently in the long term is memory loss. Examples of anxiety medications. Benzodiazepines include alprazolam, chlordiazepoxide, clorazepate, clonazepam, diazepam, esdazolam, flurazepam, lorazepam, oxazepam, temazepam, and triazolam, benzodiazepines, and Alzheimer's. Some studies have shown that prolonged consumption of benzodiazepines can even double the risk of developing Alzheimer's disease. This is because they can cause permanent brain damage. Similar effects have been observed with prolonged consumption of antidepressant medication and drugs for hyperactivity and attention disorder. Medicine 5. Medications to treat attention deficit, such as Adderall. Several medications are used for the treatment of hyperactivity disorder and attention deficit, but among the most popular are amphetamines and dextroamphetamine. They are very effective medications that help improve concentration and control periods of excitability that some of these patients have. The short-term effects are improving energy levels and concentration, decreasing the need to sleep, and suppressing appetite. But after a few hours, changes in the level of neurotransmitters such as norepinephrine and dopamine cause symptoms that can range from physical and emotional dependence on the medication to problems sleeping, lack of motivation, depression, irritability, fatigue, and even suicidal thoughts. When taken for a very long period, disorders linked to memory loss have been observed very frequently. Another problem that occurs with this type of medication is that prolonged and very high doses can cause dependence and addiction, in addition to cardiac complications such as arrhythmias and even sudden death, severe digestive problems, and other side effects. These effects can be permanent and are not reversed when the medication stops. Medicine 6. First-generation antihistamines. Antihistamines are a very varied group of medications used to relieve allergy symptoms, congestion, and common cold symptoms. Some antihistamines also have beneficial effects in improving dizziness, nausea, vomiting, and even insomnia. Among the first antihistamines manufactured by the pharmaceutical industry, first-generation antihistamines are chlorpheniramine, clemastine, diphenhydramine, and hydroxyzine. This group of medications has a broader spectrum in its therapeutic potential, but reported numerous side effects. One of the effects reported from long-term intake of antiallergics is memory loss. This is because it inhibits the action of acetylcholine, an indispensable neurotransmitter for neuronal transmission that can affect both learning and memory. New generation medications such as loratadine and cetirizine have fewer side effects and do not present these types of cognitive risks, so their use today has been widely spread. Medicine 7. Tricyclic antidepressants. The first antidepressants that were developed belong to a group called tricyclic antidepressants. Apart from depression, they are also used to combat some types of anxiety, obsessive-compulsive disorder, and pain in the treatment of chronic pain of neuropathic origin. These medications include amitriptyline, clomipramine, disipramine, doxepin, imipramine, nortriptyline, and trimipramine. The main effect that these medications generate at the brain level is blocking the action of serotonin and norepinephrine, which are potent chemical neurotransmitters, so other side effects that have been observed include memory loss. Today, there are antidepressants such as fluoxetine or sertraline, with more selective effects on serotonin reuptake that do not have the anticholinergic effects that tricyclic antidepressants have. Therefore, there is no risk of developing memory disorders or cognitive disorders. As you have seen in this video, we have presented medications that are used quite frequently, but that most people ignore their long-term effects, especially at the cognitive level. That is why it is always essential to consult with your trusted doctor if you decide to consume a medication for a long time, regardless of whether it is shared or frequently used by most of the population. Avoid self-medication and remember that all medications have adverse effects, so it is necessary to investigate the profile of each medication, its side effects, and its drug interactions. We hope this video has been helpful to you. If you have anything to add, please share it in the comments section. Like this video and send the link to your family and your best friends so they know the 7 medications that could damage your brain. If you are new to our channel, don't forget to subscribe. Remember, life is always better taking care of your health.